Please ensure that your environment is sanitized accordingly. You must adhere to all principles of the DSSC doctoral oath. This operation is intended to alleviate symptoms of an incongruous mind. Step 1. Administer the prescribed sedative to ensure the patient remains calm and compliant during the procedure. To begin the sedation process, a specialized anesthesia team stands ready to administer a carefully calibrated dose of intravenous anesthesia. This anesthesia swiftly ushers the patient into a serene and pain-free state, where sensations of discomfort are non-existent. Next, our skilled anesthesiologist deftly administers a topical solution to the specific site of the impending procedure. This solution not only serves to disinfect the area but also provides an additional layer of anesthesia, further enhancing the patient's comfort. Finally, the methotrexate injection is administered with absolute precision. This powerful sedative, known for its rapid onset and reliability, guarantees a state of deep sedation, ensuring that the patient remains blissfully unaware of the medical intricacies unfolding around them. Step 2. Secure the patient's limbs with approved restraints to prevent any involuntary or pain-induced movements. Patients who qualify for the procedure oftentimes have neurological disorders that may incur a brash and resistant mood to the procedure, so it is imperative that they are restrained. Utilize Velcro straps, carefully and methodically securing them around the patient's wrists and ankles. The goal is to immobilize the limbs effectively, mitigating the risk of unintended movements. Throughout the procedure, maintain a vigilant watch over the patient's responsiveness. Assess their level of sedation, remaining prepared to adjust the restraints if any signs of consciousness or movement become apparent. The neurological procedure, albeit controversial, is deemed conducive to a better society in the DSSC as it aligns with the state's emphasis on control and conformity, ensuring individuals are harmonized with the collective will, thus contributing to societal stability. Step 3. Identify the specific area of the brain for the procedure based on the patient's condition and make a precise incision using a scalpel. Locate the predetermined entry point for the icepick, typically in the orbital bone, just above the eye. This area has been meticulously chosen to access the frontal lobes of the brain. With a steady hand, insert the icepick into the designated entry point. The practitioner should apply gentle but controlled force, ensuring the icepick advances smoothly through the bone and into the brain tissue. Once the icepick has breached the skull and entered the brain, carefully maneuver it to the desired area for lesioning. This procedure aims to sever neural connections, altering the patient's cognitive and emotional functions. Withdraw the icepick methodically, ensuring it follows the same trajectory as the entry. We remain committed to advancing our nation's scientific achievements and ensuring the well-being of our citizens through cutting-edge medical interventions.